Hi there, my name is Tim Irvine. I'm here with my partner, Dr. Stacy Irvine. This is the Totum podcast. We're coming to you from our Toronto studio, which is a live gym, so you will hear some people working out in the background. And we're thrilled to give you some great wellness information that you can use to help yourself. And today we're thrilled to have Dr. Waj Hoda with us. Waj is a practicing chiropractor, been at it for almost 20 years now. Done an amazing job. Obviously, you have a big background in exercise and using exercise not only in your practice but before you were practicing, and all this experience helping people get out of pain, deal with injuries, and for some situations prevent them from going back into those injuries. And obviously in the world of what you do, which is injury rehabilitation, there are tons of different tools that can be used, and you recently talked to me about this paradigm shift that you had after some learning that you did. So really curious about what is the paradigm shift that you had and what caused it.
Yeah, it's a good. It's an interesting thing that happened in the last month or so, because it's been pretty recent that this shift has happened. You know, in our world, Stacy and I went to school together actually. So in our world, there are a number of courses that are always being offered, continuing education. I mean, they're offered as continuing education, but I just look at it as like just something that you would take if you're interested in the work we do. And so, yeah, I've taken a number of them and they've all been great. Our friend, who was our colleague, Andrea Spina, amazing, Dr. Spina, has an amazing course called FRC. We were one of the pioneers actually here at Totum. He taught us really early on. And so I've been lucky enough to learn a lot, and that course in particular was amazing. And I'd say the last time something kind of shifted in me was that one, and it's probably been 10 years or so since we took that one.
It's been a while.
And I've taken a number of courses. But recently I took a course called DNS, which is stands for Dynamic Neuromuscular Stabilization. And it was a course that it's oriented from a group called the Prague School of Rehabilitation in the Czech Republic, I think Czechia now. And the whole concept really fits into the direction that I've gone in my practice, which is when we first started 20 years ago, if someone had tennis elbow, you were treating the elbow. You would be doing soft tissue work or acupuncture. And maybe that's not fair, but a lot of us were. That's just, we looked locally. And every few years, you're like, okay, well, maybe the shoulder's involved in some way. Because the shoulder is connected to the elbow. And as time went on, you realize, well, maybe not only the shoulder, but the neck and the spine. So we started moving more proximally. We started moving, to the core, essentially. And things became more systems-based versus just local. And DNS is an incredible, almost like a software that really helps you understand things from a systemic level. And it starts really early on. And the thing that really captured me was how they really explain their system has to do with childhood motor development. And to me, it just really blew open the doors on a whole bunch of things that I'd been wondering as my practice had grown, and I'd seen more and more patients and more complicated patients. The system is oriented around understanding how infants, when they're born, they all go through a developmental sequence. And as long as there wasn't a neurological insult at birth, almost every child goes through the same developmental sequence. And they use that sequence to identify flaws. I mean, you can do this in children, but it's really meant to take adults or people in different sports and break down where they are weak or I don't know if the word's incapable, but at least not doing quality. Yeah, not doing quality movements. And so I mean, it's much broader than what I just explained, but really using these developmental milestones, motor developmental milestones, can help you understand what the next stage in rehabilitation for that person is.
Sure. So just to step back let's go back to the tennis elbow as an example. So
Sure.
20 years ago, it was like, oh, there's where the pain is, so let's treat around like right where that pain is.
Yep.
Versus now, it's like, okay, well, you're using your elbow incorrectly in tennis for some reason.
Yes.
And it could be related to core function, strength, stability, what have you. And it translates itself into this injury at the elbow. So yeah, there's some inflammation there that we can do some stuff with, but we got to really focus on what's happening here. Is that?
Yeah, absolutely. So much of force generation and so much of good quality movement is an integrated thing. That's what the dynamic neuromuscular stabilization thing is can we properly fixate or control and stabilize your core to produce a fixed point for your extremities to work from. So essentially, I'm trying to think of a good analogy. When young babies are born, you'd have to pay attention, but if they try to move, they kind of move like a snake. Their core does not fixate on the ground. If they reach in a direction, their pelvis or spine will shift in a counter direction. There is no fixed point. And for the first few weeks of development, until about 3 to 4 months, that whole first bit where they're spending a lot of the time on their back, we call it a supine position, their motor system in terms of abdominal stability is developing. And until about 3 or 4 months, they just can't do it, where they can't reach for an object without having what we would call like faulty motor patterning. And as that, inborn program kicks in, so these things, when we all know, you see, a horse being born or and they're just walking within moments almost. So we have these underlying reflexive movements that are built in to us when we're born, and unless, there's a neurological insult during birth, every child can go through these developmental pathways and get better. So, we were talking about tennis elbow. An example of someone who has beautiful motor coordination is Roger Federer. I mean, if you look at Roger Federer move, if you slow it down, and actually in the course it was amazing. We saw a lot of video of a lot of athletes. What you will see is a very stable, centrated core from which he can do amazing movement. And so why is the core so important? A good analogy is if you are on solid ground and you're trying to push something, and your feet are planted on something solid, it's really easy to push something. But if you're on a Bosu ball or something that is wobbly, it's much harder to push something. So all the muscles that move your extremities originate from a central origin, usually around the spine. So if your spine is unable to stay centrated, unable to actually fixate and stabilize, it just makes other things so much more difficult. And over the course of time can lead to injuries and those kind of sort of issues that we see people that have non-traumatic injuries. They come in, they're like, I didn't hurt myself, but over the course of the last few years, my knee's been bugging me or my elbow's been bugging me. And so I hope that kind of is a decent example of what I'm talking about. Everybody knows Roger Federer. Everybody can almost, they say he's about, he's almost like a ballet dancer. He's all right. He's all right. He's okay.
I love this for so many different reasons. The first reason is more of a personal one, that in my book, I have a whole chapter on instinctual movement patterns. So I agree 100% on what you're talking about. And when I was writing the book, prior to that, I have a funny example. I was in Saskatchewan. I was in a coffee shop. I was helping my mom with her hip replacement surgery. It was 50 below, not exaggerating, 50 below. So we're all walking around in all of our gear and, trying to stay warm. And a toddler comes in a full snowsuit. And they walk over to a bench, and it's kind of typical Saskatchewan. The parents are nowhere to be found, right? So I'm like Toronto going, oh, who's with this toddler? Okay, fine. They don't care. The toddler's on the bench, and they're trying to get up on the bench. And it was so cool because I sat and I watched for 15 minutes of them pitching their head forward and then getting a leg up. And I've always thought this with our kids too, is I find these patterns and these developments really fascinating because, like you said, they do it all in the same way, with the same development, at the same,
generally at the same time. Yeah, exactly.
And they use the same idea, because the part I find so cool about it is that no one's showing them. No one's saying, okay, lean forward, put your head forward. So in my mind, it is an instinctual pattern.
Yeah, absolutely.
And then we get into our day-to-day lives where we sit at computers all day and we look at our phones, and our head is, permanently forward and our core is weak.
Yes, exactly.
And then we wonder, why do we have all these issues? And I can tell you today, so at 55, if you said to me, like, just go run over there, or just go do this, I'd have to actually really think, like, wow, like, can I do that? Because I've spent way too many years detraining these natural movement patterns.
Exactly.
So that's the first thing I love about this understanding, because in my mind, the better we can understand it, the better we can coach people to be better. The other thing I really love about it is that you're then sending a patient away with some great movement training to do.
Definitely.
Which is going to not just benefit their tennis elbow, it's going to make them a Roger Federer style tennis player, obviously.
That's definitely the aim, right? and on that note, I wanted to say that, like, if you took 15 2-year-olds and you laid them on the floor and you told them to get up, they would honestly almost look the same. If you take, the same amount of 40-year-olds and you lay them on the floor and you tell them to get up, they would all look different, right? They'd all come up in different ways. You accumulate these injuries and these weaknesses over time, and it changes these normal neurological patterns that are built into us that if we exploited, we would have efficient, kind of more beautiful, more dynamic movement. And so that's what I loved about it, is some of the videos they showed of children moving, it was hard not to appreciate just how easy movement is for children, and how stable their system is. It's pretty remarkable. Just to throw this into some of our things that we've been discussing, the person who's really championed DNS, his name is I should know that, Pavel Kolash.
Yeah.
And he made DNS famous. He'd taken some of the people that we grew up idolizing in chiropractic college, people like Vladimir Yanda.
Yeah, I was going to say they're pretty closely
related. Yes, they're all part of the Prague school.
Yeah.
They were. I just want to make sure I don't mess up their names, but it's like Vaclav Vojta, Carl Lewitt, and Vladimir Yanda are like three major people in the world of manual therapy. They were all neurologists in post-war Czechoslovakia. They kind of met and collaborated, and they created this kind of system. And Pavel Kolash took it and made DNS. He's practicing now. But some of the people he's started to work on, so they used to work on kids with cerebral palsy, people with real serious motor dysfunctions. He started working on athletes in the 90s into 2000s, and some of them are like, Jaromir Jagr, who's still playing at 50. He actually also started with a javelin thrower in the 90s, Zelensky, a 3-time gold medalist. I think his record's still not broken. These people continued very late into their career, which is kind of like Roger Federer, didn't have very many injuries till the very end. And the point is if your quality of movement is great, the stress that your body goes through is much less. So you're just accumulating less stress over time.
So a really good North American example is Tom Brady, whoever knows who that is. And from what I've seen, his training style, tons of bands. I've never seen any video of him lifting weights.
Yeah.
I'm sure that there's some of that in it, but a lot of it has to do with, I think, exact quality of movement, maintaining joint stabilization and mobility at the same time, because if you're a dynamic athlete, which this is the funny thing about, for most people don't think of themselves as dynamic athletes, but every single person is exactly that. Like, we have to move around the earth, around the houses and whatever else, and the lesser quality movement that we have, the harder it is for us to do those things, and it really shows up when we get older, which there's a good chunk of our population that we see here.
Yeah,
I think too, when you and I first saw Dre doing the FRC, I think for me that was a bit of a light bulb movement, and we went to school with him, and we both admire him, but wow, he nerds it out big time, right? Even in school it was slightly annoying. And my thought when I went to the seminars is I'm glad he did the work, right? Broke it all down.
No,
because
definitely.
Those of us that are out practicing, the same thing with these guys, these neurologists who are working with these children and breaking it all down for us, that's extremely valuable.
Definitely.
And it's such a wonderful thing that you can go into a seminar with one of these people and you can say, yes, this is what I thought fundamentally, but I don't have the time to take it all apart and then turn it into exercises and figure out how, what am I doing with each patient, with each thing. So it's so fantastic that we have these big thinkers out there that
Definitely.
can inspire us to look at things a little bit differently and say, yeah, that makes perfect sense. And again, I come back to, I love the movement aspect of it, because we've always treated it that way. We've always looked at our patients and said, okay, I'm going to make you feel better. I'm going to get your pain level down, but there's a whole bunch of stuff that you have to do, or there's things that you have to change in your life. Otherwise, this problem is going to come back.
Yeah, exactly.
And what I'm thinking about, which is something unfortunately I do a lot, is we ignore pain.
Yes.
And we walk through it and we don't have time. We don't think we have time to go get it dealt with.
Mm-hmm.
I'm super guilty of this. And then you realize that up your movement chain, there's probably so many compensations and so many neuromuscular compensations, because
definitely.
I used to think of it in a physical way, this will be changing, I'm limping, I'm going to have atrophy on one side, I think of it more in those terms. But what you're talking about is even a bigger impact, because it's neuromuscular, which we know changes more subtle but bigger. And it has more control. My fascia doesn't have a lot of control over what I'm doing, but my neuromuscular system has a lot of control over what I'm doing.
Certainly. And I think the other thing I wanted to say about them that was special is these three massive people were open collaborators with each other. So not only were they big brains, they had the ability to collaborate and create something even more special in my mind. And, I'm not saying we're not quite the same here in North America, but typically you find there's a big brain person and it's almost like a competition of sorts. It feels like that's what I found amazing, is that you had these three big brains who had created their own sort of a name for themselves, and they weren't the same sort of operation. They had different ways of thinking, and from what I've understood, they were very respectful of each other even before they kind of collaborated, and they just kind of were very quick to drop an idea if they thought someone else had a better idea, and through that kind of collaboration they created something what I think is pretty unique and special, and now Pavel Kolosh is taking it and kind of disseminating it to the world. I think they started about 10 or so years ago, if I'm not mistaken, and I think it's just going to get more and more sort of use, and I think Peter Attia is a huge fan. I'm sure you guys know Peter
Yes.
Attia, and so if someone like Peter is using
Yes.
it's just, the name is just going to continue to grow, and I'm looking forward to seeing where it goes.
You mean his podcast is a little more popular than this one? Is that
Oh,
what
I
you're
don't
saying?
know. It
Maybe,
depends. It
maybe
depends.
just a little bit.
Yeah.
Depends on the metric.
Yeah, exactly.
After this conversation, no, we're
of course not.
we're going straight up.
So, question, I like to try to bring this back to practical.
Sure.
So, if somebody's listening to this right now and they're 25,
Yeah.
and there's somebody else listening to it and they're 55, those are two different populations with, a lot of movement experiences in between. So, how would you take the information that you know now and say, okay, 25-year-old, here's my suggestion for you, and 55-year-old, here's my suggestion for you?
Yeah, I think that's so different. That's why, there's no easy answer, and I like the approach because there is no sort of cookbook that teaches you to do this. You have to take so many factors. You can have a 55-year-old who like biologically and physiologically is extremely healthy and has a neuromuscular system that's really of a high quality that you have to give minimal instructions to. And then a 25-year-old who has poor movement coordination, maybe their system isn't great. So I think that's what I love about it, is it's not just like, oh, well, the 25-year-old is chronologically younger, he's going to probably pick this up quicker, he'll heal faster. I mean, some of that is true, but you can see 50-year-olds with beautiful movement quality and maybe won't need a lot of instruction and treatment. And then you can have a 25-year-old who is relatively healthy but has poor coordination and will need a lot of treatment and work. I hope that makes sense. It's really individual.
So it's less about how old somebody is, and I'm sure that there's a certain point where the age of tissue starts to change.
Yes, for sure.
And we can't prevent that from happening, but we can probably push it out a little bit. It's really, where is somebody at with their movement quality today?
Yeah.
And what's causing some of the issues? What are the good things? Okay, let's keep the good things there and work on the stuff that's more problematic.
Yeah, and I guess I should be clear. There's no question that, for the typical 25-year-old is going to have probably an easier time with things. As you move, as your movement becomes more aberrant, your fascia will change around that aberration. So the body is about trying to be efficient, and the fascial system is an elastic system that helps you create more efficiency. So if you have a motor program, say, like the way you hit a backhand, and it's not ideal, but you keep doing it, the system may create fascial lines that thicken along that sort of movement line.
Right.
And then now you have this kind of fascial thickening that you might have to do some work on. And so the longer you've had that aberration, technically the harder it is to get rid of. But again, I think that is dependent on the person. Some people might be able to get rid of it sooner. And I think DNS would be the first to admit there's some people that they probably had that movement pattern for long enough that it may not be able to change very easily, right?
Yeah,
but one thing I want to make clear is that we had even in the class I was in, we had people of all varying ages and stuff, and there were changes like even in us as physiotherapists and chiropractors and manual therapists that we could almost feel instantly because it's the neurological systems involved.
Right.
You're just changing pattern.
And it changes faster.
It changes much faster
than fascial muscle.
Exactly.
All right, so back to the practical part of it. So you have somebody coming in, say, with low back pain, and let's just say it's a pretty standard, it's like a 40-year-old, that they sit all day, they've been deconditioned, they're like a new dad or something like that, right? Like they're not sleeping.
You're talking about me?
No.
Okay, all right.
You're not new.
Okay.
You're getting up there like us. Anyhow, you have that person come in, and so are there special ways that you're evaluating those? Like, are you looking at those movement patterns right away, or are there like a few that that you're using all the time?
Okay, that's a good question. So, I mean, I love DNS, and obviously I'm espousing the the amazing things I learned there. But I have a lot of different techniques that I use. So I just think it would be individual. So if a person comes in with low back pain, I probably would run a sequence of tests that I've already cultivated over my career, along with some of these DNS ones. But let's say if we're using the DNS lens, what we probably do is just run them through a series of tests that DNS has created to see where they are in this developmental sequence. So we'd find where the hole is. So I'll give you an example. It's not perfect, but say they can't do something a 6-month-old child should be able to do at the 6-month level, which unfortunately I have to say of the vast majority of adults have lost that.
Oh my God, I want to go try these things right now.
It's actually quite fun. Listen, a 3-month-old kid is basically in a dead bug position for the first 3 months of its life.
Right.
If you think about it, they are literally doing nothing but developing their abs.
And they're full squats, right? Like we've all seen those pictures of their nice full squats.
Exactly. So like if at 3 months, if you think this kid is spending its entire life doing like a dead bug position, imagine how strong they are, right? We put adults that I see every day in a dead bug and they're shaking and they're having trouble just sitting, like laying on their back with their legs and arms up for 20 seconds. And these children are doing it for hours. Right. And then at 6 months, their legs are up in the air. They're starting to like reach their knees, and at 9 months, they're putting their feet in their mouth. I mean, and with relative ease. And of course, their limbs are different proportions and stuff. That's not the point. The point is their cores are bulletproof. So basically, take this 40-year-old with low back pain, see what they're capable of. Say they fail at the 6-month position, well, we start rehabilitation at the 6-month position, and it would look like a dead bug-ish kind of position. I'm simplifying the DNS complex. I'm simplifying the DNS system here, and I feel like I just don't want to do a disservice, but that would be an example.
No, that helps me, like, just to kind of understand. So because it's based on movements that we naturally do, like I kind of have a picture in my head of, you know, like what that would look like, which is very helpful. And I'm sure it's shocking to some people, because also you don't realize that you can't do it until you haven't done it and someone asks you to do it.
Well, and what the amazing part is you just show them. I have a poster downstairs, for instance, but you just show them, you relate how they can't hold that position, and a 3-month-old baby can, or a 6-month-old baby can. And they all go through that, like I said, they're on their back, and then they end up flipping over onto their stomach. But in that process, they're also developing their oblique system, which is their rotational system in flipping over. But all the babies go through this, and then they go through like the crawling, and then eventually walking up and holding objects while they're walking, and then into actual movement. So this progression, this system, they all have classified into different categories, and we find people where they are on this categorical scale, and we apply rehab along those lines. Because if you cannot do a 6-month dead buggy kind of position, the argument is you shouldn't be doing anything else, because they all builds on each other.
Right.
If you can't do a 6-month that 6-month supine position, you will not be able to do, as a baby, you could not do a crawl, for instance.
So just before we wrap up, if somebody listening, watching is like, I don't know where I'm at, like, what's the advice that we can give these people to find out? Because maybe they just have worked out the same way all the time, and they're like, this sounds interesting, but I have no idea where to start.
Yeah, that's a good question. I would tell them to seek out any good chiropractor or physiotherapist, because even though I'm talking about DNS specifically today, these concepts are well understood with good manual therapists, that a solid core is the foundation. And we could have a talk another time about the canister and the core and how that works. But yeah, just find a good manual therapist. Physios, chiros are very, very good at this, osteopaths as well. And hopefully they are oriented in the direction that I'm talking about, which is understanding the importance of the core, and then they can help them assess where they are, whether it's with the DNS system or not, and hopefully say, okay, well, things are looking good here, and if they are, then we can move somewhere else. But if they're not, I guess that's the greatest point I want to put across, is the paradigm shift for me. I've always understood the value of the core, but being put in a course where you're seeing developmental changes in young children, and seeing how almost all of them go through the exact stuff, and then you really do understand how absolutely solid their core is. And I haven't even talked about respiration and postural stuff, but it's part of it. The paradigm shift for me is every single person who comes in now, I assess their core in a way that's a bit different than before, and I put even more value on it than I do, even if someone comes in with a tennis elbow. Right. It's not like I'm going to just look at their core. I'll treat their tennis elbow, get them out of pain, but I will assess them to see whether or not it's functioning well, because I don't want to let them go after I've treated them and they're pain-free, and 6 months later they're in my office with the exact same thing again. That's a failure on my part.
Right.
That's fantastic. Right. And could you set up a bit of an assessment that's like a competition between Tim and I, and then to see who moves better? Because we mostly really want to know that.
Well, I'll probably stick to the 3-month position for both of you guys, because
we're old.
I won the IQ one earlier over the holidays.
I don't know. I'm staying silent.
Okay, I won the humor one.
Okay, sure. We'll give him that one, but I'm aiming for 8-month-olds. Tim's probably still at 3-month-olds.
Sorry, we're talking about psychological.
Yeah, exactly. Tim is stuck way below that. Way below that. So,
Waj, this is great. It's awesome insight into an evolving process, and we for sure will continue talking about it in future episodes.
Yeah, I'd love to. Thanks, guys.
Thank you.
Awesome. Thank you.